In the following veterinary internal medicine presentation, we are going to discuss pancytopenia in cats. Feline pancytopenia can also be categorized under the veterinary clinical pathology presentations.
Veterinary clinical pathology. Pancytopenia in cats. This video is a collaboration between the Vet Video Library and the Veterinary channel. What is pancytopenia? Veterinarians use this medical term to indicate that your pet's red and white blood cell count is extremely low. These cells are necessary for your cat's health and well-being, and a lack of them can result in anemia and dangerous illnesses. Because pancytopenia can be fatal in cats, it's critical to get your pet to the veterinarian as soon as possible if you see any signs. Clinical symptoms of pancytopenia in cats. Some cats don't display any symptoms, therefore, if you have more than one cat and one of them has pancytopenia, you should have your other cats evaluated as well. Some cats may exhibit subtle symptoms such as tiredness, restlessness, inability to eat and pale gums. You might also notice more severe symptoms, such as their mouth was bleeding, feces that is black or has blood in it, they have blood in their urine, sudden collapse. If you notice any of the symptoms mentioned earlier, contact your veterinarian right away. What are the causes of pancytopenia? Your cat's white and red blood cells are made in the bone marrow. Therefore, damage to your pet's bone marrow can cause it to cease working correctly. Bone marrow dysfunction indicates that your cat's body isn't getting the right amount of blood cells, resulting in pancytopenia. The following are some of the possible causes of pancytopenia in cats. Toxins. Feline retroviruses, as per example, feline AIDS (FIV) and feline leukemia, can trigger pancytopenia in cats. When their immune system overreacts to an infection, it attacks their tissues and organs, resulting in sepsis. Cancer of the blood. Cancer of the bones. Abnormalities of the immunological system. How can you know if your cat have pancytopenia? Your veterinarian will do a blood test to determine your cat's blood cell count. They can tell if they're low or not from here. If their levels are low, your veterinarian may order additional testing to rule out other possibilities, such as urinalysis, scanning of the body, and biopsy of the bone marrow. How will my veterinarian handle pancytopenia? Pancytopenia does not have a specific treatment. However, your veterinarian will give supportive care, which will most likely require admission to critical care. Among the various types of treatments available are transfusions of blood to boost their blood cell count, antibiotics. Granulocyte colony stimulating factor (GCSF) is a blood growth factor that seeks to stimulate the production of white blood cells in the bone marrow. Unfortunately, many of the causes of pancytopenia are fatal, and the treatments described above may not always be practical. In some situations, your cat may not survive, or you may have to make the heartbreaking decision to euthanize your pet.
In this presentation, we discussed what pancytopenia is and how does it affect your cat. Veterinarians use this medical phrase to describe how low your pet's red and white blood cell count is. These cells are essential for your cat's health and well-being, and their absence can cause anemia and other severe disorders. Because pancytopenia in cats can be fatal, you should take your cat to the veterinarian as soon as possible if you see any symptoms. Symptoms in the clinic. Because some cats don't show any symptoms, if you have more than one cat and one of them has pancytopenia, you should get all of your other cats checked out as well. Some cats may have minor symptoms like tiredness, restlessness, incapacity to eat, as well as pale gums. You may also experience more severe signs and symptoms, such as their mouth was gushing blood, excrement that is dark or contains blood, their urine contains blood, unexpected demise. Contact your veterinarian straight away if you see any of the symptoms listed above. A variety of factors causes pancytopenia. The bone marrow produces your cat's white and red blood cells. As a result, damage to your pet's bone marrow can cause it to stop functioning correctly. Bone marrow malfunction causes pancytopenia in cats, which means your cat's body isn't getting enough blood cells. Some of the possible causes of pancytopenia in cats include toxins. Feline retroviruses can cause pancytopenia in cats, such as feline AIDS, FIV, and feline leukemia. Sepsis occurs when an individual's immune system overreacts to an infection by attacking their tissues and organs. A type of cancer that affects the blood. Bone cancer is a malignancy of the bones. Immunological system anomalies. What are the symptoms of pancytopenia, and how can you tell if your cat has it? Your veterinarian will perform a blood test to determine your cat's blood cell count. From here, they can discern if they're low or not. If their levels are low, your veterinarian may request further testing to rule out other options, such as urinalysis, body scanning, and bone marrow biopsy are all used to diagnose this medical condition. When it comes to pancytopenia, how will my veterinarian treat it? There is no specific treatment for pancytopenia. On the other hand, your veterinarian will provide supportive treatment, which will almost certainly necessitate admission to critical care. The following are some of the several sorts of therapies that are available. Blood transfusions, to boost their blood cell count. Antibiotics. Granulocyte colony stimulating factor, GCSF, is a blood growth factor that promotes white blood cell formation in the bone marrow. Unfortunately, many causes of pancytopenia are deadly, and the treatments listed above may not always be appropriate. Your cat may not survive in some cases, or you may have to make the difficult decision to euthanize your pet. Veterinary channel. Feline pancytopenia. Veterinary internal medicine. Pancytopenia in cats.